Okay, this feels a little bit like the old days of our town halls when we saw those numbers of guests rising. We are very happy to see you. I guess not happy that we're having this same conversation that we've been having for a while, but we are, and we really appreciate your taking the time to be with us this evening. Let me just give you a little bit of the way we see this. I think it's going to be 12, 12, and 12. I'm going to try to not speak for more than 12 minutes. Then we'll have the high school, although they're basically a fully vaccinated bubble. They don't have much to say, but we will hear about the high school protocols, and then we will hear from Dr. Lisker, who will hopefully confirm that we didn't make any mistakes in the first 24 minutes of our presentation. I'll share with you some of her wisdom, guidance, perspective, which has been so important to us over the last, I think we're talking about 18 months now. So thank you to Dr. Lisker, thank you to the medical team, thank you to all of you for taking the time to be here. We are very excited to be welcoming your students, your children, our students, next week in school. It's going to be a strange September. We have pretty much at the Academy a day and a half of school before Rosh Hashanah, but it is what it is. I actually think that that's going to work to our advantage, and we'll talk about that in a minute. I also want to thank our teachers. I know for the Academy, this is kind of both a faculty meeting and a parent town hall. We don't normally do it that way, but because the information was so fast moving and rapidly changing, and we've been out for a couple of weeks, we asked for our teachers to, understanding to be doing this together and really learning about some of the protocols in their classrooms at the same time that we're sharing that with our parents. The good news is that we've done this before, thank God, and that gratitude that we all feel for the fact that we had 170 in-person days of school last year is still very much with us. I certainly know that I was on the field on the last day of June, hoping that this was, almost completely behind us or completely behind us. And as we know, that is not the case, but I do think that we are in a good place. We're in a very vaccinated environment. 2,000 people in this community between all of our students and teachers, and about 1,200 of those people are vaccinated. Just about everyone who's eligible to be vaccinated is vaccinated. That is a huge difference between this year and last year. I will say that I think we're also in I'm going to say a little bit of a more polarized environment. By that I mean that we go to the shuls that we go to, we hang out with the people that we hang out with, we read the papers that we read, and we speak to the people that we speak with. And I think last year we all knew how little we knew, and we recognized kind of within a spectrum, within the range of possibilities, what we needed to do to keep people safe. And I think that in a community of 673 people on this Zoom call, times a few, so you're talking about a community of thousands, the ranges of opinions about what is wise, what is prudent, what is necessary, what is healthy, physically, psychologically, short-term, long-term, social, emotional development, risk tolerance, based on my experience, is really, really broad. And I think that, my first appeal to the community is to recognize that. I'm deeply grateful for the kind of respectful dialogue and discourse that we generally have around here. I'm grateful for all of the emails that I've received, that our nurses have received. And I apologize for those that haven't been responded to yet, but I promise you that I've read them all in terms of advocating for different things. But I'm actually going to ask everyone to understand, which I believe that you do, that the things that people are advocating for in the name of care for their children, care for the safety and development and social well-being of their children, can be vastly, vastly different depending on your perspective. And we've done a pretty good job, this community has done a pretty good job of not necessarily agreeing on every detail, but being able to live together with a sense of respect and also a sense of, I think, integrity for the decision-making process. And I would hope that even when you don't necessarily agree with this particular policy, protocol, decision, too stringent or too lenient, you recognize that this is a broad community. You recognize that these decisions were made with the best intentions and with integrity, and that when we think that something can change, or that we did something that should be changed, that we're open to listening and to changing it when that is appropriate. And finally, I would say that we're in a rapidly changing environment. We met with the medical committee on Tisha B'Av, actually. Tisha B'Av afternoon, we had a meeting and we all agreed that we're not even going to talk until the middle of August, because it didn't matter, because so many things were changing. The data was changing every day, and people were having meetings that then had to be, rehashed the next day anyway, because the information was changing so rapidly. So we actually did that. We certainly had, shared a bunch of emails and chats, etc., but we did not meet until really over the last week to hash out what our policies are going to be. And actually, even since then, things have changed. There's a new governor in town. There's a new law, which is a mask mandate, which actually takes a decision away from us, at least for the time being. We're still going to talk about what we hope to do, what we intended to do, what we intend to do, and hope that the law will catch up with us between now and the end of the Chagim. And of course, we are committed to following the law. We're committed to following the guidance of the various, of our own medical committee, and of course, the stuff that's out there, with the understanding that that's not always something that everybody in the world agrees with, in terms of all of its details. So I guess those are all the long words of introduction, which leave me about 4 minutes for the rest of it. But I will get to the first slide. Becca, if you don't mind, thank you. That's me. Okay, let's go to, I think we can, yeah, we did that. Okay, first of all, as I said, we have about 99% of our faculty and staff vaccinated. We have 98% of eligible students vaccinated. We do not have all of that documentation, but we don't have all of it. Our nurses have been calling, particularly over the last couple of days. Please make it easier for them and make sure that you upload your documentation. And if you have a medical exemption, we need to obviously have that. We need to vet that. And we need to make sure that the commitments that we make to our community are commitments that we can stand by. I will ask you again, and I felt this. I think that the decision to mandate the vaccine was not something that we took lightly. We know, even if it's a small percentage of people, but a small percentage of a large community are people that matter, and people that we respect and we take seriously. And we know that for some people, this vaccine mandate was uncomfortable. It's not something that we actually normally like to do. We don't like to tell people what to do in their private homes and certainly with their bodies. But this felt like either way was making a decision about the health of others, and therefore we along with many other institutions decided to take that approach, and we deeply appreciate the respect for that approach. And of course, when there is a need for a medical exemption, we're here to vet that. But we're proud to say that we are very, very close to there. I think the 98 is closer to 99, and we hope to be as close to 100% as possible to make sure that we can provide a safe and secure environment for everybody. Of course, in the academy, it's 99% of eligible students, and that leaves about 600 kids who are not vaccinated, and that's where it gets a little bit more challenging, as we will talk about right now. Go ahead. Thank you, Becca. Okay, I want to go through these things quickly. Everything I say will be followed up in an email. If there are follow-up questions, we'll try to respond to them. And there might be things that we don't know the answers to, and certainly things that are going to evolve over the next week, over the next month, and over the next couple of months. I'm sure you saw the news. We were going to ask for masks, certainly for all the unvaccinated people in the building, but for everybody for the month of September. That is now law, so it seems. So of course, that's what we're going to do. So we are going to, despite the fact that we thought we were done with that, at least for many, we are going to be having everybody indoors wearing masks, with the exception of 2-year nursery, 3-year nursery, and 4-year nursery, where masks, just like last year, will not be mandated. Again, that is currently, I believe, that is still in line with the rules of the governor, but we will continue to make sure that everything that we're doing jives with that. And if there's any change in terms of that, we'll let you know. The rest of it is pretty straightforward right now, even if we're not happy about it. We are not going to be requiring masks outdoors, except for very specific situations, which is not very many. And we hope that will be able to, whether it's October or a little bit later, it really depends. For those grades right now, it's going to be 7th and 8th grade. Later in the year, it will eventually be 6th grade, and perhaps later in the year, it will be everybody if the vaccine is approved for younger kids, to be able to ease up on the masking, whether it's to completely ease up or ease up in certain situations, but I'm not going to go into that now because it's not relevant for now. People have been asking about pods in classes. Last year, we had pods of 14, 15, 16, roughly, throughout the building. That was not a number that was mandated by the government, by the way, that was our own. The number is a little bit higher this year, but it's in no place is it really more than 20. There might be one class of 21. But that is the number of kids that we're going to have in a class. And that is going to allow for 3 feet of distance within the classes, which means that we are going to try our best. We all know that even with the 6 feet of distance with little kids, we certainly couldn't guarantee that there was never a crossover within those 6 feet, but that we're going to have enough space in the building to maintain generally 3 feet of distance, and allow us to have integrity of classes. We are not, and this is a big change, we are not going to be strictly separating classes. We're also not going to be chaotically mixing classes. What does that mean? I'll try to give you a couple of examples. For specialty, in the 2nd grade, we'll have 2 classes that join together or break up actually into 3 different groups for specialties. So you're going to have kids in 3W and 3X who are with each other for 45 minutes for specialty, even though they're not in the same class. What that means basically is that we're going to be contact tracing aware, we're going to be pod aware, but we're not going to be kind of strictly limiting the mixing between pods. That also applies to after schools, which I'll talk about in a second. So there is going to be some mixing between pods, but we're going to know about that mixing, and we'll talk about the contact tracing in a minute in terms of as it relates to potential quarantines. Busing, again, same thing, less than what we had last year. We required 6 feet of distance, trying to find 3. Requiring masks, of course, on buses because you've got kids from different grades at different places. Tefillah, tefillah is basically by class in most of the classes. In the middle school, we're working with these bands. A band is basically a half a grade, so you talk about 45 kids. There are times, for example, at tefillah, middle school is a weird thing because 7th and 8th grade is vaccinated, 6th grade is a harder group, but we will be allowing a band to gather in spaces that are large enough to have some distance. So we are going to be davening by band. We're going to be having lunch by band. And that means that there is some potential contact tracing ramifications, which we'll talk about in a second. In the middle school, there are also some other places where we'll have to, for example, in the ELC, we'll have most of the lunch will be taking place in the building in the classroom. So lunch, at least for the first month, I just spoke to Iran. He was really excited to be going back to this, but he's amazing, and he's going to go, he will be delivering lunch for the most part to classrooms. But for example, in the ELC, where we have a beautiful big lunchroom, we'll allow 2 classes separated to be in that same large space, but to know that there's much more than 6 feet of distance between the groups. So allow us to be aware of when these pods or when these classes are mixing with each other. And the same basic thing for recess. Again, we're going to do as much as we can outdoors. When we're outdoors, we're going to be aware of big crowds, but we're not going to be requiring masks outdoors. And again, we're going to kind of, for contract tracing purposes, we're going to be aware of where people are, when people are with each other. Sports leagues are going to be vaccinated, only sports leagues for now. So 6th grade sports not going to happen for a while, but 7th and 8th grade will. After schools, I know that they were sold out. First of all, thank you for all of your patience. I'm happy to hear that people are happy to have their kids in after schools. We have a robust after schools program. Those after schools programs will be masked, and they're also relatively small groups of 10, groups of 12, groups of 14. So again, we'll know which after school you're in. It doesn't mean you're automatically going to be quarantined if something happens, but we will know. We will be able to do that contact tracing research in the case of after schools. I'm going to talk about contact tracing in a second. Events, we're going to be emailing. I know there are even some events next week, so we're going to have to figure out. The first grade orientation will be outside. We're not going to be having mass events right now. We're not going to be gathering kids on the steps. We're not going to be gathering large groups of people in the building. We won't, for the most part, even be gathering a grade anywhere indoors as a full grade. We just don't think that's prudent right now. But hopefully we'll be able to give you an update even before Thanksgiving, and share good news around that. I want to talk for a minute about Smachot, but not take too much of the extra time that I'm already taking. In terms of Smachot, we are going to be sending within the next week, Bli Neder, we will be sending specific guidelines and recommendations. Again, I want to talk about the nature of the way we work. We're a community. We don't control things that happen everywhere, but we do try to appeal to your sense of respect and responsibility for the people around you. So even if you have a certain comfort level, but you're inviting kids to a simcha, we hope that you invite kids to a simcha where they'll all feel comfortable. That applies to the kashrut, the dancing, and the corona protocols. And we ask you to be respectful of that. So of course to follow state guidelines and to basically be in line with school guidelines. We'd like to encourage minimal smachot, not hundreds and hundreds of people at simcha, big spaces, outdoor spaces, masks certainly indoors for those who are unvaccinated, but we will get more into specifics. And I know that some people have, obviously, thank God, there's smachot coming up every day, every week. We've been in touch. I've been personally in touch. Others have been in touch with some people who are planning smachot. We're working with you. We're not here to make it difficult for you. We want you to have a meaningful simcha. People have had very beautiful and meaningful smachot that were different last year, and we hope that we'll be able to work with you to make sure that it's a meaningful simcha, but also a simcha where everyone feels comfortable with the health protocols, so that we don't have people who can't come to a simcha because they feel like it's not in line with their own level of comfort. So we ask you again to appeal to your sense of respect and integrity of that system in terms of that. We're not going to be we're going to be asking any visitor in the building, that's service providers, volunteers, parents, people picking up. We're not going to lock people out of the building like we did last year, but we are going to require vaccinations, and we're going to go through a protocol in terms of how we do that. For certain events, it will be like shul on the honor system. For certain events, we're going to ask for documentation, and we're going to again appeal to you to be respectful of the things that we ask for, and understand that we're doing that to make sure that everybody feels safe and secure in our environment. I am over time. I'm sorry. So, Rabbi Hartstock, Rabbi Kroll, you're on. Oh, and I didn't do. Okay, 2 more seconds. Contact tracing is going to be different than last year. Last year, for the most part, if there was a positive case in a class, there were 1 or 2 exceptions, but basically we quarantined the whole class. We are hoping not to do that. I can't guarantee that we're not going to. We're going to interview teachers. We're going to find out exactly what happened in every situation, but the guidelines of New York State currently are, and we think that they make sense, that if we can ensure the integrity of our system in terms of masking and distancing, that we will not be required to quarantine a class in the case of a positive symptom. And of course, for teachers or for older kids who are vaccinated, it's much more simple. I'm sorry that I don't have time to go more into that, but I just want you to know that. So it's going to be a case-by-case situation, but we do hope that we'll be able to say, you know what, we can trace a couple of close contacts, but we can say that at lunch there was a lot of distance. We can say that during the day there was integrity to the masking, and that we're not going to require an automatic quarantine of an entire group because there was 1 positive case. But you know what? If we find that we're wrong, if we find that there's a spread, that decision might have to change, and we know that you will understand that. Becca, don't worry about the next slide. We're going to send it out, and I want the high school to have their time, so thank you.
Okay, good evening. Thank you, Rabbi Krass. Becca, thank you. I'm going to just move right to the next slide, please. And first of all, I just want to say hello to everyone. I hope you had some opportunity to enjoy some summer. I want to welcome new parents, families who are joining us, and new faculty as well. I'm looking forward to a wonderful year together. I want to begin by just sharing some of the general information as far as the high school is concerned. I think that the vibe in terms of the orientation, the disposition between high school and academy is very much the same, but as Rabbi Krass mentioned, because all of our students are eligible for a vaccination, that changes the circumstances. So I want to express tremendous gratitude to families, to parents, to students, and to faculty for really pushing through. As Rabbi Kraus mentioned, people are in different places for a variety of reasons around this, and I am proud and very pleased to be able to say that administration and faculty, all of the adults and staff who are going to be working in the building, we have 100% vaccinated, and students, over 99% of the students are vaccinated. There are a small number of families who appealed for exemptions and are working with our doctors, but that as an overall environment of 100% faculty and staff and over 99% of students makes for what we consider to be, like Baruch Hashem, in our environment where we can operate school pretty close to normal. As was mentioned, we had one thing in mind earlier in the summer, and then it shifted a little, and then with the governor's decision, it shifted even further. But we had made the decision even prior to the governor to require masks for the month of September for us to settle in. There is this, I guess we were feeling a balance, on the one hand being cautious, making sure that the environment is safe, but also want to reiterate and to state very strongly that we feel like the achievement of that bubble within the high school building is what is going to allow for regular classes to happen on floors, all grades in. Each grade will have their floors they had in the past, and will be in regular classrooms. We are going to ask for some distancing. We're not going to be measuring 6 feet, but spreading it out so that there are maybe 3 feet between each desk in a way that feels like it was, but is also responsible to the circumstances that we are living in. So we are requiring masks in the month of September. When it comes to lunch, so we are two things that are of importance. One is we are allowing students to go across the street to be able to, again, that opportunity to feel like you're just can get a breath of fresh air by going out or across the street. That is back in place. But we are asking students to bring whatever they're taking across the street back in to the school, on the school property, so that all eating is happening within that bubble. For lunch, we are allowing students to eat in the cafeteria or over the gym, meaning that space that's designated for eating and being able to sit around a table, again, with a reasonable group, not crowded. Or we're going to encourage students to be outside for lunch, especially as, right now we're talking about the month of September. We have our eight days of school for that month, and we'll see exactly where things stand come October. So they can students can take masks off during lunch, and again, we'll use the outside as much as possible. Or if I call in a couple of minutes, we'll talk a little bit about our outside spaces, which we are excited for as well. And we feel prepared. When I say we're writing optimistic after the Chagim, really depends, of course, on what is going on with the Delta variant, etc. And it depends on the governor, who's we're going to follow the law, as has been said. But important to say that we feel like the environment that we have is one that can support kind of the maximal level of safe interaction that will be allowed for, we'll be ready for. To give a little bit of a sense of what that means kind of day to day. So as I said, regular classes on the floor, students will be masked all the time during September with a little bit of spacing. On the other hand, the opening school assembly, we've had a tradition always that the first day and the last day of school, the whole school gets together in the auditorium to kind of start the year together and end the year together. We are going to gather everyone in the auditorium, because with vaccinations and masks sitting next to each other, it would be okay for a circumstance like that. On the other hand, open school night for parents, which we had assumed would be in person, we are going to do on Zoom, again, to be cautious given the circumstances. The small number of unvaccinated students, those who receive it as an exemption, are going to be asked to mask and distance. There are some after school activities that they will not be able to participate in, sports, which is more, which has more contact, and other school activities where there is not such contact, the students will be able to participate in as well. I want to talk for a moment, I'll talk in the next slide a little bit about protocols for faculty and students who are not feeling well. Just want to note, we had mentioned earlier at the end, right before the summer, that we will not be using Zoom for regular learning over the course of this year. We plan on continuing that policy. Given the realities now, the only circumstance that, if God forbid a student needs to be out of school for a long time for things unrelated to COVID, a surgery or something, of course, that's a circumstance where Zoom is useful and can really be a lifeline for a student. The other COVID-related circumstances, if someone needs to be out must isolate for 10 days in this, because of COVID. In a circumstance like that, we would allow for Zoom use, but otherwise we are not using Zoom. And I'll just quickly, before handing it off to Rabbi Kroll, want to go through, again, just to get a sense of the difference of the importance of the way that this plays out for this, the fact that faculty and students are vaccinated. Because of that, if a vaccinated individual comes into close contact with someone who tests positive, that individual may come right back to school. You don't have to stay out of school for that. You have to wear a mask and take a test on day 5. That can be a rapid test, and we are putting Russi back to work. Thank you, Russi, for everything as always. But that student, that or faculty member, even though we're close contact because of the vaccination, that allow them to continue on a regular routine, just to be tested on day 5. Low risk symptoms, get a rapid test, and if negative, same. Even with those sniffles, we're not using Ruvna, we're not doing the morning screening, but we do ask that people pay attention to symptoms. But even again, close contact, low risk symptoms, just take a rapid test under those circumstances. And high risk symptoms, if a person has a fever, then person always be home for having the fever, but also can get a rapid test. So all of that means that vaccination allows for regular life in school to continue in most circumstances. It is only if someone who actually tests positive must isolate for 10 days. So it is our hope that school, God willing, we look forward to welcoming everybody back, faculty early next week, and then the students in the middle of the week, and look forward to getting not exactly back to normal, but back to normal in many ways. I'm going to hand it to Rabbi Kroll to talk a little bit about some of the kind of programming ways also, and the building in which we're getting back to normal as well. Rabbi.
Thank you so much, Rabbi Hartstock. It's great to see everybody here. I guess Rabbi Hartstock talked about the nitty-gritty details of COVID, and I get to talk about some of the fun stuff that's going on in school. Just want to highlight it very quickly before we hand it off to Dr. Lisker. A couple things that are going on, just to take a look at. That's not CGI. There's actually a photo. It's not Photoshop. That's a photo of the rooftop terrace above the auditorium. That area, we put turf on it this summer. We're furnishing it with nice outdoor furniture. We have access to it from the 4th floor and from the 6th floor. It's going to be a really beautiful space where kids are going to spend time eating. It's a good place for lunch. It's a good place for hanging out. It's really nice out there. It's an exciting new addition for this upcoming school year. Also wanted to highlight another difference, another new initiative, the Kci Sar Food Pantry that we had, kind of designed and built in the school last year. It was really wonderful. And thank you to so many parents who have volunteered, and there's always more opportunities to volunteer and get involved in delivering food packages to those who need them in the Bronx. We have, it was taking over our school. We had so much going on. We have relocated it to what was formerly 99-cent store right on Riverdale Avenue, adjacent to the school. So kids will be working in there also, but it offers a lot more opportunity to do this in a much more kind of like robust way. Just want to highlight that there is, programming is taking place normally. I mean, we'll be masked, but we have freshman orientation as normal. We're having sports tryouts this month. Parents and kids will keep their eyes open when these sports tryouts will be taking place. We will be having late buses once after schools are starting. We are having chagigot. The school is going to feel like the vibe and the energy that we need to have and we are used to having in Sting Nation. So those chagigot will be taking place. The first one scheduled for October. Our plan is we're aiming for having Shabbatonim as well. And as Rabbi Hartstock had mentioned, open school night is going to be taking place over Zoom. We are I just wanted to convey to everybody that we are going full speed ahead, and we have a lot of really exciting normal and invigorating programs that we're really working on for the start of the school year. I'm just really excited to see your kids in just a few days. With that, I'm going to hand it off to Dr. Gita Lisker. Dr. Lisker is a pulmonologist who is one of the key members of our medical advisory committee, who has spent a tremendous amount of time and energy advising, helping all hours of day, night, doesn't seem to sleep. It's surprising to me that she actually does seem to have another job besides working on SAR. They tell me she works full-time as a pulmonologist, but she also seems to be working full-time for SAR. So thank you for all of that volunteering. And with that, I hand it off to Dr. Lisker.
Thanks, Cole. Hi, everyone. As always, I'm going to start with my thank yous to the SAR administration, who never ceases to amaze me for their thoughtful, intelligent, and increasingly difficult roles in decision-making, and easy for the medical people to make recommendations, but they're the ones that have to implement everything. To our wonderful nurses, as always, who thought they were coming in for an easier year, but I guess, haha, that's funny, not happening. And to our parents and our students, and that really make our job so much easier by sharing our commitments to health, to the health of the community, to social responsibility, to the human race. And what we've accomplished here is only possible because we have the administration that we do, but more importantly, because we have the parent body and the students that we do. So, and I work with other places as well, so I can tell you that very easily. So I'm not here to talk about policy. I'm just here to give a basic general update on the Delta virus and what I do. It's true, I am a pulmonologist, and I actually run an outpatient program caring for sick people with COVID. So I do that for Northwell, though I specifically state on record, I'm supposed to do this, that my opinions stated here are not related to my job at Northwell Health and only for myself. So as everyone knows, the Delta variant has basically taken over as more contagious variants of viruses are apt to do. So as of this week, it's 94% of all cases in our area are Delta. So basically, it's totally taken over from the original Alpha variant, which is what so many of us had to begin with, and what the vaccines were designated to. But there's still good news. What we know about Delta, and I'm sure everybody really, this is all over, right? It is definitely much more highly contagious than the original Alpha variant, which is why it's taken over because of its contagiousness. The other thing about Delta that we clearly have seen is that it's much more efficient at infecting kids. So whereas with the original infection, we knew, the kids were much less likely to get infected or were less likely to spread it, Delta does seem to be infecting kids more efficiently. On the other hand, what we have not seen, and what Delta has not shown itself to be, is any more virulent or any more dangerous than the other variants. And that is very important to remember. So while it is much more contagious, it's not any more dangerous if you actually get it. And I really want to talk about vaccines. They're not perfect, and we know that, but they are our only hope. They are the answer, and they are doing a great job still to this day. So with the Delta variant, and again, this is not what the vaccines were intended to. Yes, there are definitely breakthrough infections. Everybody on this chat knows somebody with a breakthrough infection. I see, 7 to 10 people a day with breakthrough infections. It happens. But it should be still remembered that your likelihood of getting a breakthrough COVID infection is still almost 10 times less likely than to get COVID if you're not vaccinated. So they happen, but still the vast majority of infections are happening in unvaccinated people. That's number one. So you're much less likely to get it, but it happens. Number two, these vaccines are excellent, 93, 96% efficient at preventing severe COVID. And if you have to remember that the reason that we did all of this and the reason that the country shut down and the state shut down and all of this was because of the severity that COVID was causing of disease and because of what it was doing to our healthcare system. And that, thank God, in our environment in New York, even if we're only at about 60% vaccination rate compared to other parts of the country, you can see that is enough. Our hospitals are not overflowing. They are not overwhelmed. And pretty much the only people in the hospital with COVID right now are the unvaccinated. So the overwhelming cases of COVID in breakthrough cases of vaccinated people are mild disease. Now, I don't mean that doesn't mean you're not going to feel sick for a while. You will. You might have 102 fever, but it's flu-like. I mean, if anyone has ever had influenza, metapneumovirus, RSV, I mean, these viruses make you feel really bad. But they're not landing you in the hospital. And that is the key thing, to remember. Through the end of July, the statistics that we have was that 0.004% of vaccinated people who got COVID had a hospital admission, and 0.001% of people died, vaccinated people with COVID. The only caveat, of course, and this is a population I have to talk about, we're talking about vaccinated people with competent immune systems. So a particularly hard hit population, there is no doubt, are people who are immunocompromised despite getting the vaccine, are still getting pretty hard hit with COVID. The most serious of that are those with organ transplants, where they're really the most heavily immunocompromised, but in less so, but still significantly, people who are on medications that are lowering their immune system. But I cannot say this enough, and this is, and I get the numbers, and I have chats we have 17 hospitals in our system. With the exception of the immunocompromised, severely immunocompromised, or the very old, or the people with very sick underlying disease who really get admitted with a cold, I have to tell you, we are not admitting vaccinated people to the hospital with COVID. And I cannot stress that enough. Yes, everybody may know someone. Oh, my uncle was, yes, if you're immunocompromised, it's, that's a special case. And if someone is 97 years old and has underlying disease, like I said, they get admitted with everything. Jesse Jackson, by the way, for those who are throwing it out to me, didn't need to be admitted to the hospital, in case anybody was interested. But because of his status, he got admitted. Sometimes that's not a good thing. So that's the one thing that I really want to drive home. The other thing that I want to talk about is there's been a lot of talk, especially after the Massachusetts outbreak, about the viral loads, and they're the same and they're just as contagious. So even something that just came out, which is great, even if the initial infection, the viral loads, meaning how much is being PCR'd out of their nose, is the same. And I want to be clear, that does not mean that they're just as contagious, because it's not a culture, but the viral particles may be the same at initial diagnosis. People who are vaccinated clear that load exceptionally quickly, meaning the initial virus hits the nose. Yes, the virus is there, but your immune system takes over, and within a day or two, those numbers are plummeting, meaning you are not contagious for nearly as long. And that is also going to affect spread. So that's basically where we are. For the fully vaccinated people, and I don't want to minimize the fact that it is extraordinarily inconvenient to get COVID. You will have to be out for 10 days. Your vaccinated close contacts do not have to quarantine. Your unvaccinated 7-year-old will have to quarantine. It will have to be home for 10 days. And it is extraordinarily inconvenient, but it is not dangerous. And so a lot of the risk-benefit analysis that are going on right now between psychological health and living life normally have to be weighed against a totally different, cheshbon, I would like to say now, between what is inconvenient and what is dangerous. So I'm just here to give everybody a little bit of hope, because I know I'm speaking to a vaccinated population. Okay, for kids, and I'm not a pediatrician, so I do adult medicine, but I actually vetted these statements with my pediatric colleagues to make sure that they agree with this. Is that people are also all over the news. Hundreds of kids admitted to the hospital. Delta is clearly more contagious, and it is infecting kids more frequently. It has not been shown to be any more virulent or dangerous in kids than the alpha strain. But if you're going to have 10 times as many kids get Delta, you're going to then have 10 times as many kids admitted to the hospital. But it's not because the percentage or the likelihood of getting severely ill for the kids is up. It's just that the total numbers are up. And so even for the kids, everybody should take a deep breath. I would like to also just discuss, on top of all of that, the benefits of the protection of the vaccine. We do have new therapeutic options right now that can decrease your risks even further. So monoclonal antibodies, right? Monoclonal antibody treatments have been around now. We've been giving them since probably around December. They have been shown, when given early in the disease for COVID, definitely to decrease severity of disease and to decrease hospital admissions. They're most effective when given early in the course of disease, although I know we give it up to 10 days. Other places will give it up to 7 days from the time of their first symptom. They're only given to high-risk people. People should know that whereas high risk used to include everyone over 65 and a whole host of diseases, and a BMI over 35, which was compatible with obesity, recently that has actually been changed now, the BMI of 25, which really just puts you as overweight. And pretty much, I don't know, like 85% of America is now qualifies for monoclonal antibodies. So someone who does get sick with COVID, even if they're vaccinated, if they do have a high risk criteria, that they can be referred for monoclonal antibodies, which will decrease their risk even more. More recently, and again, this is just a general update, there's actually now monoclonal antibodies approved for prophylaxis after a close contact in somebody who is both high risk and immunocompromised. And so that is holding a lot of promise for our immunocompromised people if they have a close contact immediately after the exposure to get the monoclonal antibodies to help them fight off the infection since they may not have made their own antibodies. Additionally, for the immunocompromised patients, it is now actually recommended to get 3 doses of the vaccine, not just 2. This is not a booster. This is if somebody is a transplant patient or somebody is on severe immunosuppressive therapy for Crohn's disease, for multiple myeloma, for MS, for anything, there should now automatically be the first 2 doses, let's say a Pfizer or Moderna, and then 28 days later, a 3rd dose. That is pretty much standard. That has been shown to protect somewhat for our immunocompromised people. And finally, the boosters. Yes, pregnancies. Thank you. Somebody actually, if you want me to list all the inclusion criteria, pregnancy is now listed. It's actually anyone over 65, anyone with a BMI over 25, chronic kidney disease, heart disease, high blood pressure, diabetes, pregnancy, as well as socioeconomic factors. As far as the boosters, right? So this is the immunocompromised. That's not a booster. You should get 3 doses. For the boosters, they came out this week and said after 8 months, you should get a booster. You will be eligible to get a booster with either Pfizer or Moderna, and they're still working on what to do if you got for J&J. My own opinion, and we definitely know that as antibodies wane, your likelihood of getting breakthrough Delta is going up. So a lot of what I'm really not sure how they came up with the 8 months, because most of what they're getting is from Israel. And in Israel, they were doing it after 5 months, and after 6 months, and now they're actually giving it after 5 months. And they've actually shown really good results with that for decreasing breakthrough infections. So everybody should talk to their doctor. But I think at this point, if you were vaccinated in the winter and you're 6-7 months in, and with Hagim coming up where people are going to be literally on top of each other, as we generally are, it might be a good time to start thinking about getting a booster, and you should talk to your doctor about that.
Dr. Lisker, thank you very much. And I'm going to ask you if you could stay on, we'll try to moderate a couple of questions, and we want to try to be at least close to true to our time goals. I think a lot of the questions were answered. We are not doing testing prior to the first day of school. That was a discussion that we had. We can revisit it for after Sukkot. We are in a different environment than the camps, I would say. For sure, kids are going, back and forth every day, certainly every weekend, and mixing with different people. So the efficacy of that testing is limited. Although, as you saw last year, there were times that we felt that it was important to do. So we will revisit it again for after Sukkot if we think that's warranted. Somebody asked me a question about the ELC, the 2s, the 3s, and the 4s. We weighed that as well. It was in line with a lot of the guidance that we had last year. Honestly, it could go either way. We know that there are parents who feel more comfortable with masks, and those parents have had their kids in masks. Obviously, we know that everyone's affected by the people around them. And frankly, for kindergarten, it was a hard decision to say that we have to mask. And for your nursery, 2s, 3s, and 4s, we decided to stick with what we had last year, unless we see data proving that we should be doing something differently, and that we're in touch with the committee. A couple of people asked about the vaccine decision. Dr. Lisker, correct me if I'm wrong. There was no dissent on our vaccine mandate decision at the medical committee level, or at the administration level at all. We were really all on the same page in terms of, like I said before, I don't think it was an easy decision. We don't take it lightly when we tell other people what to do, but we did feel like this was the right move, considering the situation that we're in, and that we wanted to have everybody to be able to be safe and in school this year. We will be sending out more specificity in terms of the symptoms that we would recommend testing for. Tina Lerner in particular, Dr. Lerner is working on that with our nurses, and I don't want to start listing symptoms and make mistakes, but we'll get that out to you. We are certainly not encouraging sick kids to come to school, and we're not encouraging to overtest and not to undertest. If we think the symptoms require testing because that makes sense, then we're going to do the testing. We did hundreds of tests last year. We're ready to do them this year. We will do them. And we've had a pretty good system in terms of being able to get results pretty quickly. Dr. Lisker spoke about the time frame for the booster, and there was one question I wanted you, Gita, to middle school space and layout. The middle school space is there. It's grown a lot over the years. We have classes of 15, bands of 45, and I'm happy to answer any particular questions about that. Like I said, in the middle school, we're going to be doing a lot by class and by band. Most of the mixing will be limited, therefore, to half the grade of 45 kids. 7th and 8th graders are vaccinated. 6th grade is a little bit of a tougher spot, and we'll have to make sure that we can do the contact tracing appropriately over there. And 6th grade, as we spoke about before, is also a time where there are Smachot, and we need to be on top of that. Oh, Gita, if you want to, sorry to put you on the spot, but I will. I know that it hasn't been approved yet, but what are your thoughts? What are you hearing about the vaccines for younger kids in terms of? I know that you're not involved in the approval, but in terms of the recommendation, your thoughts about it?
I mean, we're hoping that it's going to come through, right, for ages 5 to 11, sometime over the next several months. I mean, these are going to be. These trials are very vigorous trials that are going on, and I have an 11-year-old, and as soon as it gets approved, I'm looking forward to giving it to her. So,
okay, thank you, and obviously we understand that as you know, as we're talking about younger kids, it becomes a, you know, for some people, a harder decision, and we'll obviously communicate with you and you know, as transparently and openly as possible once that becomes a reality. Travel policy right now, we're following local guidelines. There are no automatic travel quarantines. There are a lot of airlines and there are a lot of countries that are requiring PCR tests before you come into the country. I know Israel requires that. So obviously that's what you're gonna have to follow. But in terms of school, right now, there's no additional travel restriction or requirement. In terms of attendance at school, we do ask you to communicate with us, and if we ask for information, we hope that you'll be forthright with that, you know, so that we can know what we're dealing with, etc. We would love to do another vaccine drive. If we get the vaccines and you want them, we'll give them to you, no problem. We have a gym. Yes, the answer is sure. If they offer them to us and people want them, not exactly sure which teachers are going to take the 7-year-olds for their vaccines in the middle of a gym, but we'll figure it out. It was great to have, and obviously we would love to be able to work with them again. Rabbi Hartstock, Rabbi Kroll, if you saw any high school questions that I missed. Everyone liked the green roof. Okay.
Of the roof.
I think they liked it.
Green roof too, it's just not ready yet.
Yeah, it's a little bit misleading. It's I understand this. There was some disappointment.
It is green.
It's green. It is the color green. It is it is not organic though, but we will, as I indicated in the chat, we'll be adding some fauna to the and flora.
All right, green, but it's not completely green. We got it. Okay. All right, Jack. There he is. Nope, he's still on mute. He'd prefer it that way.
I saw somebody asked about whether we're allowing people who are unvaccinated to come into the building. Our policy is that all the adults coming into the building need to be vaccinated. You know, as far as that goes for other things that we're going to be having in the future that are kind of bigger events, that's to be determined how we're going to run something like, you know, 8th grade open houses, but that's a long time from now.
Okay. Jack, you want to have the last word?
You know, so you're looking for my medical opinion?
We got some Talmudic opinion based on the shots behind you.
So that it's as used as my medical books. No, I
Thank
think
you very much.
It's a hard beginning as always, and you know, appreciate what everyone is doing, the staff, the medical team, and let's hope we are more successful this year than we were last year.
Amen. Wishing everyone a Shana Tova. We look forward to seeing you kids in school next week. Thank you.